Hello and welcome to another CARP information session. This time with Dr. Peter Zalan, who's been with us before on our CARP sessions that we attempt to inform the community. And Dr. Zalan, this time you have had a career as an anesthesiologist, putting people to sleep. But lately, since your retirement, you've been trying to wake up people as to various concerns in our community with respect to health issues. We've worked together on long-term care. We've worked together on what we can do for our seniors population. But now we're looking at something a little broader. And in a recent article in the Sudbury Star, you said when it comes to COVID, it's not over until it's over. And you know, that article had a lot of very, very, I guess you'd have to say almost scary well, I won't call them predictions, but, situational things, because really, you were looking at the situation now as compared to what it was, and it doesn't seem like what our politicians are telling us that it's over. Is that your theme?
So it's not, just 1 second. Karen is working in the background, crumpling things, but she promised to be quiet.
So it's sometimes difficult to, our spouses, it's very difficult to say that to them, right? To be.
Well, she's a good woman.
I got one of those too.
Anyway, no, basically, I think things are getting better, but I think people are being a little too optimistic. And there are things that we can do that will help. And while those things are possible, we should seize on them. And I think there's a lot of folks who are in our age category, which includes yourself, myself, and lots of, I guess, CARP people.
Oh, yes, definitely, yes.
For sure, are kind of a little bit uneasy about all of a sudden, as of March the 1st, the passports are gone. You can have as many people as you want in the restaurant. And who knows, maybe at the end of March, there'll be no more masks. We should just celebrate and life is good. So I think that may be a little premature. And we don't want to have what you would call the fifth wave. We already had the first wave, the second wave, the third wave, and the fourth wave. And I know that Premier Ford is really keen, to get going and get over. And actually, I'm sure everybody in the community is keen to get on with life.
Well, I think we all are keen, but we know from our members that some of them really are a bit apprehensive, because they're, all of a sudden, we see these numbers, and in our own hospital, they don't seem to be going down. And, we're really wondering, is it really safe to get out there and to take off the mask, to really breathe in other people's faces, which we do anyway, if you don't have a mask on. And the reason, I guess, why the common cold and influenza is spread so easily. I know my pharmacist told me that in the past couple of years, the medications for the common cold have gone way down, and common cold infections and the regular, influenza has disappeared. And I guess that's because it's all transmitted through the air. And if that's the same thing with COVID, aren't we sort of in the same situation?
Well, exactly. In fact, you can, the fact that we've had very little influenza is precisely because people have been masking. All the things that we've been doing to prevent COVID have also prevented influenza. So let me just transmit on the air here what I've actually written, because there are some really practical things that I've written, and that can actually help and decrease, illness in the community. So
that when you're talking about COVID itself, now we have one of our family members was one of the first individuals that caught COVID when it first came out 2 years ago. and it's still suffering some effects. She's suffering through the long term, like long haulers, I think they call them. And and of course, her condition, when she describes it, it's not something that anybody would want to go through for, a healthy middle-aged woman who, participates in the gym, is very active physically, and yet it almost knocked her out. And we can understand why it was so severe with older people, if that's how it affected younger people. But it seems like younger people are out there. They're all, they're doing their thing. And there is, however, in our experience, it seems like everyone we talk to, someone's had some experience. Someone knows somebody that's perhaps died or has had the infection, and now sometimes not too serious, but other times, it has affected their health rather dramatically. Now, is it really still a concern? We look to the States and we see these stadiums full of people, and they're all practically cheek to jowl. And so, you can understand you have the anti-vaxxers out there and this sort of thing. So, really from a very practical point of view, how should we be looking at this?
Well, just to answer your own question, it's true as to what's been going on in the United States, but they have paid a price for that, because it's now estimated that approximately 2 to 3 times as many people have died, this is per capita, in the United States than in Canada. So personally, I much rather be alive than dead. So that society decided to do minimal isolation and to pay the big price for it. So let me just say a few things here. So as you're just saying that according to many, coronavirus is just another virus like influenza. And I should add that a lot of people die from influenza. And it's exactly a good thing to get. And Premier Ford himself said this, that it's time to move on from public health restrictions. So as people are done with these rules, like vaccine certificates, and as you said, and masks, and we should just be like the United States, right? So as of March the 1st, we've lifted capacity limits and ended the vaccine passports. So, but it's interestingly, it's the very same day, March the 2nd, that Health Sciences North President Dominic Giroux said, right now, for us, this week at HSN, it's been the worst since the pandemic started. And as of today or yesterday, it still has 72 patients in hospital and even more outbreaks. So things are not terrific, like you said, at the hospital. And up until very recently, all the medical officers of health, all they talked about is what we got to go with is what's happening in hospitals, right? Because just getting a cold and you're over it in a week, that's okay. But when people are seriously ill in hospital, in intensive care units, and are dying, that's a totally different story, right?
No, we seem to be in a situation here compared to other parts of the province. Perhaps the eastern part of the province is somewhat like us, but we seem to be having higher rates than other sections of the province. Is there any reason for that, you can think?
Well, I can't answer the reason as to why it's happening, but it's definitely happening. And if it's happening, then you should do something about it. So maybe for parts of the province, which things are peaceful, there aren't so many infections, you can start cutting back on some of the rules and restrictions. But in areas of the province where things are really going in the opposite direction, you don't cut back. Different strokes for different folks. And in fact,
and there seems to be this feeling that, the term, I think it's endemic, that they keep putting out there, like car accidents. You're still going to have car accidents, so therefore we have to live with it. Is that what they mean by endemic?
That's what they mean with it, exactly. It's like the flu. We've had it forever, and we're going to have it forever, and you just have to learn to live with it. Well, it's entirely very possible that we'll have the coronavirus, COVID, forever. But that doesn't mean that right now is a safe time to stop doing the things that we've been doing, and certainly not safe to stop doing those things in Sudbury. And then there's a few other things. A lot of elective surgery still remains undone. If you noticed, people are now dying in increasing numbers. And in fact, just in the last 3 months, we've had twice as many people die as in the entire pandemic up until December. So I don't think that's a good thing.
Oh, no, are those people dying from COVID, or are they dying from other?
Well, here's the thing. It's been impossible to get the data to tell us that. Were the deaths, as you said, predominantly due to coronavirus, were due to other causes, and they just happened to have an infection with the virus? What was their vaccination status? Were they all unvaccinated, or were they all triple vaccinated? Were they at the end of life, where the virus was the last straw? Like, it'd be very important to know that, and I've tried to find it, and I can't find it anywhere.
So this is data that really, I think that we all base, or really scientifically, we all basis of determinations on actual data that what is actually happening.
Exactly. So how come we don't have it? I mean, that's a relevant question to ask. Now, to get on to children,
is this a health unit responsibility, or is this a hospital responsibility in your mind?
That's a public health responsibility to calculate, to keep and basically somebody would have to be examining all the deaths, for example, and telling us those things. All the information is there. Somebody would just have to dig through all the files.
Yeah. Now, with respect to our members, now we have 1,700 members, CARP members here in Sudbury. Our branch covers a certain portion of Northern Ontario as well too. Now, as I mentioned at the very beginning, some of us are rather apprehensive in your medical experience of, considering the COVID and what's gone up until now. What advice would you give to those of us who are in our, well, some of us are a little older than others, but we're looking at our CARP organization is 55 plus, but we have quite a few up into the 80s and 90s as well too. Now, with respect to our situation, would you recommend still being cautious going forward, considering our present situation?
Well, I think so. Now, also depends on what your definition of cautious is. Certainly, you need to have gotten your third vaccine. I would suspect that most seniors have done that. So actually, we're in a good category as far as that's concerned. If you haven't gotten 3 shots, then certainly get your 3 shots. As far as going out into the community, I think you should wear a good mask, because you really have to wear what they call a 99 mask, whether it's a K99 or an N99, but one of those masks that actually works, as opposed to the thin little thingies that many people are using. And I certainly wouldn't throw your masks away when you're indoors and there's lots of individuals, whatever recommendation the government finally comes out with. As far as that's concerned, so those things, I think people should still be careful with. And certainly in our community, where the hospital numbers are not encouraging and increasing number of people are dying, you certainly don't want to go to a restaurant which is full of people.
That's true. We also have, I know we've also had healthcare professionals who have also been infected as well too.
Oh, no question. Yeah. So let me just continue. Just to talk a little bit about children.
Right.
Because children are the major transmitters of infection. And if you're a senior and you've got grandchildren, then you're obviously at a certain risk. So only 55% of children 5 to 11 have received their first vaccine, never mind their second vaccine. And this is, as I said, troubling because they're the main transmitters of infection. So how about older individuals? People for over 18, only 58% have received the booster, which is the third vaccine. And these numbers have only slightly increased in the last month. So in other words, vaccinations have pretty well stopped. People are not getting vaccinated anymore because they think everything's okay.
Right.
So if you're a senior and you have children and you have grandchildren, you really want to make sure, and they haven't gotten their booster, if they're your children, they haven't, and the parents have decided not to vaccinate their children for whatever reason, try to persuade them to do so. At least if they may not get too sick when they get their COVID infection, but think of you.
That's right.
So in other words, please care about the grandparents and get yourself vaccinated and get your children vaccinated. So I
understand also that what I was reading recently is that just the 2 shots is not going to be particularly effective against the latest virus. That you really do need that booster shot. Would that apply to the younger people as well?
Well, yes, it applies to everybody. Essentially, the data shows that the chances of ending up seriously ill in a hospital or an intensive care unit is significantly higher if you've only had 2 shots. So yes, it really makes a difference that if you've had the third one. So, but people are not getting vaccinated anymore, and we're stuck in the 50s. So we're very proud that people have gotten their first shot or their second shot, and it's approaching, say, 90% or 89%. But we've done a really lousy job with the third shot, and children have done and young people have done a really lousy job.
Is this because of pandemic fatigue? People are tired and they think, oh well, we've gone through this for 2 years. You know, I'm just going to put it aside, and you know, it's not going to get me.
Well, that may very well be the case, and maybe also because the vaccine isn't very good at preventing the latest Omicron. You still can get infected. So lots of people are getting infections, but only mild infections. So that they figure, well, if you can't protect me from even getting a mild infection, I'm not going to bother anymore.
No.
But it's actually faulty thinking. And actually, the thing that has made Canada has done so well overall with COVID is because a lot of people have gotten vaccinated. So I don't know if you heard what just happened in Hong Kong very recently, but Hong Kong now has the highest COVID death rate in the world. And this is an area that had virtually no deaths whatsoever, but they have really low vaccination rates. And if you can believe it, among people who are above 80, only 30% of people living in Hong Kong have gotten vaccinated.
Well, that, you know, it takes, I can recall being a much older person, a little bit older than you, Dr. Zalan. Yeah. I can remember the terror that accompanied polio and how us young people were, you know, we were afraid to go to the beach, afraid to associate with our friends because polio was crippling and in some cases killing our friends, our young people, and how we all lined up for the polio vaccine when it became available. And now, of course, polio does not exist. But this won't be quite the same though with this virus. It seems it could be around for a while.
I think this one's going to be around. It could be around indefinitely, just like influenza. And it's still a new version will still come along. So there's actually a few more things that seniors should advocate for. And one is advocate that the provincial government and actually the municipality who share the funding will fund public health properly. Because before this whole pandemic started, I don't know if you recall, but the province was thinking of cutting back funding.
That's right.
And it's in between, because of the pandemic and because of actually the opioid crisis that we also have, and all the other things that public health has to do not cut public health funding. In fact, we need to increase public health funding. And
Now, is it possible for our own public health unit to institute controls or protocols different from what the province seems to be their direction?
Yeah, I think if things are different in each region, in each public health unit, public health medical office of health has the power to do so. Yes. So if Dr. Sutcliffe wished to keep the mandate, the restrictions that we had before March the 1st, she could make it so if she chose to do it.
Mm-hmm. Well, I understand that businesses themselves can decide,
That's right.
independently if they wish to maintain a certain degree of protection as well for their staff and clients.
You're totally correct. In fact, what I personally believe is that instead of getting rid of this passport, they should make the passport that you need 3 shots to be fully vaccinated. In other words, right now you only need 2 shots, and the 2 shots don't seem to be working too well. So I agree that the passport as presently constituted is not very useful. Mm-hmm. So make it that you need 3, because I don't know if you recall, but when the passports first came out, a whole bunch of people got their 2nd shot. Mm-hmm. So it was a great motivator. Right. So just say, hey, if you want to get into a restaurant, you have to have 3 shots.
Mm-hmm. Well, of course, we know that we have those who say that this is affecting our freedom. Sure. I don't know if that means your freedom to die or what, but one person's freedom is another person's freedom, you might say. So, but these restrictions, on one hand, we have the political arm really wants to reinvigorate the economy, open up, as they say, where on the other hand, we see in Sudbury that we seem to be going in the opposite direction, which is very sort of disheartening, at least. But you're feeling that it is necessary.
Well, I really think if you want to get the maximum, well, basically the whole idea, I want the economy to be free. And what's going to happen if we have a 5th wave, then everything will be shut down again. Mm-hmm. So if we don't want that to happen, I want people to go to restaurants, but we should feel comfortable about going. And if most people got their 3rd shot, they could still all go to the restaurants, right? The whole idea is that we want to protect society, right?
Well, we're, as you say, we're all in this together, and we are running out of our CARP time here a little bit, but so the final message is, and I think what you said in the paper was that it's not over until it's over, and you're saying it's not over.
I don't think so. And if you just look at what's happening in Sudbury today, it's pretty obvious that it's not over. Mm-hmm. And I hope things don't come back, but I don't know if you've heard about wastewater testing.
Yes.
Which is coming to the fore as because we really cut back on testing the average most people, right? You can't get a test anymore unless you're really seriously ill. So this way we can tell how each community is doing. And overall in Ontario right now, the wastewater testing shows there's a small increase actually in infections in all of Ontario. So it's not the greatest time to cut back on restrictions. You know, it's better to be a little cautious and just hang in there. And then hopefully everything will work out. And in the meantime, let's get everybody vaccinated with the third shot and with the children.
Well, thank you for that message. And as you know, no one likes to be the bearer of bad news, but then again, we all like to be warned of any consequences. And I think you've done that. And you know, we certainly thank you for continuing your efforts. I know that you were representing the medical staff there at the hospital for so many years, and you know, you've had a great career. And here you're continuing on, you know, with health warnings for all of us, and we certainly appreciate that. Dr. Peter Zalan, thank you for being with us.
And thank you for all those kind words.
Bye for now.